Welcome to our short video on accessing clinical overviews in VisualDx. VisualDx enables students to build differentials, view drug monographs, and view clinical overviews. Students must access VisualDx from the library's website and log into the ERLP or the Electronic Resources Login Portal using the username and password they have been assigned by the IT department. From the library's homepage, library.rvu.edu, navigate until you see the A to Z databases icon. On the A to Z databases page, click V and then click VisualDx. Log into the ERLP using your assigned username and password. On the VisualDx homepage, students can start by searching a symptom, such as a headache. They can enter in a drug, such as Tylenol, or they can enter in a diagnosis, such as diabetes. VisualDx will start recommending options as more keywords are added. In addition, students can build a differential by using the Quick Start Builder. VisualDx covers multiple specialties, but the strength of the resource is in dermatology. For our example, choose Dermatology Skin of Color and select Rash and Multiple Lesions. VisualDx will build a workup of findings based on your starting point. The starting point dictates the workup. For instance, back on the homepage, if we click cardiac/pulmonary and then cough, we'll see that the workup is different. We have information related to chest radiology as well as distribution. Navigate back to the workup for our rash or multiple lesions. For our example, let's set our patient age to 30 to 39. The assigned sex at birth will be male. Our skin lesion type will be scaly papule/plaque. The plus sign indicates that more options are available. For this, we'll choose scaly plaque. Under location of skin findings, you can choose a distribution or body location. For our example, we'll choose body location. We'll first choose scalp. You can choose all scalp, or you can get granular by area. For ours, we'll choose scalp, and then click off. And then we'll also add in face here and add some granularity. We'll choose the forehead. We will choose the eyebrow, as well as the nose here, and then we'll add those into our findings. Under symptoms and signs, we will choose arthralgia, as well as we'll input an additional finding that's not in the checkboxes here. We will input nail pits here as well. And you can choose the first one here, nail plate deformity. That'll add it into our findings. We'll now go to the appearance of patient. We'll say the appearance of the patient is well. For the onset of findings, we'll choose reoccurring episodes or relapses. We're going to leave exposures blank. For medical history, we'll choose history of immunosuppression/immunocompromised. We'll leave travel history blank, as well as we'll leave negative findings blank. Since we have no additional findings, we're going to click on View this differential. Once all of the relevant information has been added, the system will return the results, typically 60 diagnoses that are sorted into consider first, consider second, infectious, drug-induced, and then you have the option to view all. You can also sort the results page by the default view, photos, symptom icons, or a list, and change the size of all of the information. For our example, we'll choose psoriasis. When you hover your mouse over the diagnosis, you'll see that the number of findings that were matched that you've inputted, are matched to the clinical overview. There's also a colored bar here that will go up or down depending on the strength of the findings. Let's go ahead and click on psoriasis. We'll click See Full Article. And now we can review the clinical overview. We have an outline here of the contents, diagnostic pearls, best tests, management pearls, therapies, and the references used. We have our images here for this specific clinical overview. We also have the ability to print this out and also access patient handouts, as well as we can review the contributors who helped build this specific clinical overview. Lastly, students can click on the UpToDate link and jump over to the library's subscription to UpToDate and access clinical overviews from UpToDate based off of the differential they built in VisualDx. Students with questions about VisualDx should contact the library at library@rvu.edu.